Yes, he did.
Donnybrook is made possible by the members of the 9 Network.
Hey, thanks for joining us for this edition of Donnybrook. So good to have you with us. We are once again kind of partitioned from each other, practicing our social distancing, but we're really happy because tonight we're going to welcome the Chief Nursing Officer from Mercy Hospital. Robyn Weilbacher will be with us. That'll be in the second half of the program. But first, however, let's meet our cast and crews, starting with the news director for the Big 550 KTRS, Wendy Wiese, along with our favorite columnist with the St. Louis Post-Dispatch and a Donnybrook founder, Mr. Bill McClellan. He is another founder of Donnybrook back in 1987. Ladies and gentlemen, he now hosts In the Know on the Big 550 KTRS, and he writes quite a bit for the Riverfront Times. We'll get into that. Ray Hartmann. And our favorite columnist for the St. Louis American, and you hear him on 97.1 and 590 and beyond. There he is. Oh, Rock Chalk Jayhawk, Mr. Alvin Reid.
Hello.
I'm not sure you're allowed to advertise that on PBS, Alvin.
Oh, not for profit, you know.
Well, folks, if you're going to contribute money to KU, send it to 3655 Olive Street.
Oh, there you go.
Hey, Ray, we've had some developments since we met last week on Donnybrook. Number one, the mayor of St. Louis, Lyda Krewson, said that she would extend the stay-in-place order for her city indefinitely. She said the situation is fluid. She had a press conference today. Also, Sam Page, the county executive for St. Louis County, said pretty much the same thing. However, at his press conference today, the governor of the state said that while he will extend certain social distancing restrictions in the state of Missouri, Governor Mike Parson also said that he wants to be back and open for business on May the 4th. It's all going to be based on data and testing and the number of beds, et cetera. But last night, Tim Fitch, county councilman, had an interesting proposal for you regarding the governor and cities and counties. Can you share that with our viewers?
Well, Tim Fitch, who I've stuck up for a lot lately on our show, and then today on his Twitter account, suggested that he thought Mike Parson had the right to overrule the city and county if he wanted to on their stay-at-home orders, citing Ferguson. I think it's one of the worst ideas of all time. I don't think it's going to happen, although Mike Parson, in my judgment, has done so much worse than horrible in terms of the state's response, and it just continues on. It's part of a national political argument. It's really embarrassing how bad the Parson administration has mishandled this.
Well, does he have a point, though, if during Ferguson, remember they sent in Captain Ron Johnson and the state took over there? How does that differ from what's going on now?
Well, what was in Ferguson wasn't an infectious disease, first of all, and it wasn't a pandemic, and it's an entirely different set of circumstances. And the only thing dumber than the notion of Mike Parson on behalf of people that perhaps feel less affected by this outstate coming in is the notion of Donald Trump doing it to the governors. It's just a ridiculous, horrible, worse than bad idea.
Well, the good news is I don't think there's a chance in the world that Mike Parson is suddenly going to become a proactive governor and take charge of things. I think that the governor's content to kind of see what happens and not charge ahead and try to impose any orders on the city or the county. I think Tim Fitch just had a silly idea, and he's had a lot of them over the years, as nice a fella as he is, wanting to arm teachers and now have the governor come in. I don't think it's going to happen.
Well, as every day goes by, it just seems like people are playing to their base and their audiences, because it's not just politics. It's kind of everywhere. And I think that's part of it is. Fitch knows that that's not going to happen, but by throwing it out there, that appeases to some people that would probably vote for him in the next election and would vote for candidates he will support in the next election. And that's what's bothersome to me is just that this is as serious as it is. It's now political football time, and it's just getting kicked in so many different directions that people don't expect the things they are saying to happen, but they're saying them anyway. And it's frustrating.
I could actually see it happening, Bill. I could see Governor Parson in the interest of business moving forward, and attempting at least something similar to this, and the political trajectory today, as you said, all of you around the country, in Michigan and Kentucky especially, it's been noticed that you've got these armed, white, angry, let's get back to work people who are shutting down traffic, and they are freedom fighters. If you are talking about the Black Lives Matter movement, they are thugs. So that's kind of an interesting contrast in the way that we have also a pandemic drives us into our political silos. It is, if you think about the way these people who are vocally, almost near rioting at these state capitals to get back to work, how they're being treated in some corners as opposed to Black Lives Matter. It's hypocrisy at its finest.
And I think Bill's right that I don't think Parson will do it, but I think part of the problem with Parson is what he's not doing is almost as bad as what he is doing. So, for example, I'll plug it, but we just posted a news story at the RFT that 2 people have died and there are 57 infected in the state mental health facilities in St. Louis. It's not that it's such a scoop. It's the fact that our state Health and Human Services, HHS department, which is supposed to be protecting us and providing us health information, they have it on a request only basis. So here it is, 57 people in our community, 31 of those heroic frontline health workers have COVID-19. 2 people have died, and we had to call them to find out about it. It's very consistent with Parsons' intention to minimize this so we can, quote, open the state. It's really pretty disgusting, actually. And it's not so much the Parson. I agree when I say I don't see Parson actually overriding Ida and Sam, who I think are doing the right thing here. But it's just horrible that they've got this.
They are doing the right thing, Ray, but he dragged his heels. He only recently and begrudgingly enacted a stay-at-home order for the state.
It's not even an order. I agree with you. It's a suggestion. I agree with that.
Well, I think, Wendy, to your point about like what's happening in Michigan and everything, I think that Governor Parson might say on May 3rd, outstate Missouri is open and ready for business. But I don't think that he or outstate Missouri really cares much about the city of St. Louis or the county. And I'll buy you dinner, Wendy, if Mike Parson tries to open the city or the county on the 3rd.
Well, let me ask you this,
because
Wendy,
then the restaurants will be
last
open.
week,
I think, Bill,
Wendy, last week you were against opening county parks, but this week, Tim Fitch, the aforementioned county councilman, along with his colleagues Ernie Trachis and Mark Harder, suggested to County Executive Sam Page that at least 7 of the county parks be open. Maybe not all 60 plus, but 7. How would you feel about that, Wendy?
Well, the reasoning behind it does make sense, because they are saying that is driving the closures are driving the people into smaller areas in municipal parks. So I think if we were to start, you can only hope at this point. You can't force people to exercise caution. You can't force people to effectively socially distance themselves. At this point, you just have to leave it up to the individual. But if it is presenting a risk on the other end and driving more people into smaller areas in municipal parks, then try 7. I will compromise. I'll compromise there.
Yeah,
I can go either way on this. Oh, ahead.
No, I was just going to say one of the parks is Jefferson Barracks, and I did get a call this week on KMWX from a listener who said that once they closed the Jefferson Barracks Park, all the walkers went into the cemetery. So, yeah, people are going to get their exercise on a nice day.
Right.
They're going to go somewhere.
I could go either way on this, and to defend Fitch on this, he wants to see some of them open. He did, upon questioning by me, agree that the playgrounds should be closed in those
That
parks.
goes without saying.
And I think
they
that
want to close. They want to keep
it's
the
like
basketball
state park
courts.
system. I can see both sides of it. Illinois closed theirs, and unfortunately, a lot of people from Illinois then are coming here with potentially. And that's one of the things that bothers me on that last topic of the idea of these rural folks who do, by the way, come to the metropolitan areas. So they're out there having a nice party, possibly infected, coming to St. Louis.
What are you talking about? That is ludicrous.
It's crazy, but
that is ludicrous for you to say that. What are you talking about?
Sides on the park.
Do you have any evidence of infected people from rural Missouri coming to St. Louis? Any evidence whatsoever?
Well, people from rural Missouri come to St. Louis and Kansas City all the time. And my point is, if they're not going to practice social distancing and they're going to act like there's nothing to see here, they very well could bring it here asymptomatic.
Ray, it's silly.
When people from rural Missouri
and vice versa,
it's usually for something like to go to a baseball game or to go to a nice restaurant.
That's not happening.
All those things are closed. I don't think we have to worry.
I know one person from St. Louis who went to a party in Texas. Our friend Ezekiel Elliott.
I think that we are in this together. And the idea, I understand because they don't have as much testing, that people in rural Missouri don't feel this as much, and it's understandable. Most of the, I think, Bill,
but
you were
Ray,
point.
Their numbers are way down in some of these counties where some of them have like
but
0
that doesn't
cases.
Mean that there aren't, because they also don't test. And my point is,
but life
we don't
is
know
different there, Ray.
Got it, who doesn't?
Some people could walk for miles and still be on their same property in some of our counties in rural Missouri. And that's not the case. You really can't compare life in some rural counties to congested areas like the Central West End.
I'm not.
Hey, well, what do you think of Bill McClellan about the St. Louis County Council, where a couple of members are complaining that, well, the chairman there, Lisa Clancy, is not allowing public hearings on spending, and that the county executive is running some meetings afoul of the Sunshine Law, and that members of the county council are not being given information on the matters they're voting on. In other words, everything's being expedited, but good government is taking a hit. How do you feel about this?
Well, I think it's awful what the county council is doing, and it's the Democrats on the county council who are doing it, and they seem to be doing it with the blessing of Sam Page. And I noticed that, the Post-Dispatch is desperately trying to get information, but they're having meetings without quorum, so the Sunshine Law doesn't apply. And when our reporter, I think it was Jeremy Kohler, asked Sam Page, a spokesperson, a former Post-Dispatch reporter, Doug Moore, Doug said something like, there's just so many requests from the media. And I thought, well, come on, Doug, at least answer our requests first. You used to work for us. So, I'm very unhappy with the Democrats.
I don't understand why you can't do it. They do it in sports where with the umpires and things like that, you have a pool reporter. There's one person, but they're working for every journalistic entity out there. They simply get a statement or they cover the meeting, and then whatever they write, whatever they do, it goes out to everybody. It's property of everybody. I don't know why they can't figure out something like that. I don't think it's impossible to do business, do governmental business right now. I know it's difficult, but that's the thing. You have to do it. You have to find a way to, without this, like say, lack of quorum and some kind of way, you've got to be able to have the public, maybe not speak at the meeting that they're watching online, but at least be able to watch it all. I don't know. This situation is new to me too, but it just seems like there's ways to get these things done without going to that extreme.
You're absolutely right. And look at the technology that the Nine Network is using. Look at the technology that is being used everywhere. I mean, across the globe. You would think that the council could find some way of making it available and accessible to the public and transparent. I don't understand. I don't understand how they could even venture down this road in the first place.
Hey, Alvin, you brought up sports. What'd you make of the XFL going bankrupt and in the process leaving the St. Louis Sports Commission on the hook for $1.6 million in bills that were supposed to be paid?
Okay, everybody gets this mixed up because it was mixed up. I think in the lawsuit, it's not the Sports Commission, Frank Viverito, not the guys. It's our CBC. And the rent was paid for the first two games. We had 3 remaining home games, the third of which was going to probably have more than 30,000 people, and they were going to open the top part of the dome. It was going to be quite the spectacle. I just don't understand how you go from that point to bankrupt because you have missed several games. Now, I understand that they knew that they were not going to complete the season, but complete bankruptcy smacks of how much money did you have and what was the television contract really like? And also, our coach, Jonathan Hayes, is owed like $666,000. Mark Trestman, $777,000. Bob Stoops, $1.08 million. Were these people working for free until the end of the season where they were going to get one big check? There's just a lot of mystery to it that we will find out, I guess, in the bankruptcy hearing. But put it this way, it obviously was not on as strong a ground as led to believe by many members in the media throughout the United States, and especially St. Louis.
Well, 2 words, Vince McMahon. And I mean, I said at the time, first of all, before we had a team, I remember saying, if Vince McMahon is part of this, we got a problem. And Vince McMahon, who is, by the way, not only pals with Donald Trump, but just been named today. This week was named to be on his little council of how to reopen the government. That's how prominent he still is. I always felt, enjoy the Battlehawks for what they are. Nobody could see this coming. To Alvin's point, it is the CVC, and really, we're not out any money. They paid rent for the games they played. This is all part of the contract going forward that would have been owed to St. Louis. So it's like the Battlehawks were what they were, which was a great community kind of group.
I mean, for 2 weeks,
games, and I always said enjoy them. But the idea that they were some poke in the eye to Stan Kroenke, all this stuff, it was just enjoy it for what it was. It turns out it was 2 games.
But Ray, Governor DeSantis, correct? I mean, am I right here? The day after the day after the XFL declared bankruptcy and said that they were no more, DeSantis grants McMahon and the WWE essential status. And of course, wrestling is essential.
Yeah. I mean, you got to understand, in their defense, in Vince McMahon's defense, he's come up with the only organization that Donald Trump accepts with the word "world" in its title.
But let me ask this.
That's it.
Oliver Luck was the commissioner, was he not?
Yes, he was.
He is or was.
And he might still be, right?
And he happens to be an old classmate of Charlie Brennan's, does he not?
He does, I believe.
He is,
Maybe we could get some answers from our provocateur.
Well, to be honest, I did text him last week. I said, hey, if you want to join me on the show, you're welcome to do so. And then he said, you can get me at this email. And then that was the last I heard from him. So I have no idea. But we are out of luck, one might say.
Out of luck.
Was it XFL? Was it old
So
luck?
is he.
XFL.com? They took his email away?
Well, let me ask you, Alvin Reid, I want to ask you about the homeless tents that are sprouting up on Market Street, pretty much at the 1300 block, 1400 block, 1500 block. And, the city would like to move them into the old Little Sisters of the Poor building in North St. Louis. In fact, they have rented some of this property. Only a few homeless have taken them up on that offer, but others have said, hey, leave them where they are, even though, they're obviously not social distancing. They do go through the city, touch things, and, you wonder if it's a very healthy situation there in downtown St. Louis. Do you think the members of this homeless community have a point or what?
Well, the point is they're trying to make a point. There's so much of this going on right now that, it's all happy time and wishes. We're all in this together and we're here for you. And then the punchline at, Lincoln Financial or at McDonald's or well, now it's like at homeless, right? We're out here and there's nobody else downtown. So it's our chance to be seen and make our plea on behalf of the pandemic. It is a health concern. So thus maybe they should be spread out, sent to, the facility that you spoke of. But I think they're now not because they can't find someplace else to be, but because they want to make a point, like so many other people are making a point.
The courts have ruled that you can't move them unless you provide an alternative location. That was I think the Ninth Circuit Court of Appeals, if I'm not mistaken. So maybe that's one of the reasons why the city got that property at the Little Sisters of the Poor, so that they would have some place to move them to. But these members of the homeless community have a lot of friends with video cameras. And when the police showed up, according to the RFT, the police kind of backed down and wouldn't move them at 4:00 in the morning.
Well, and these are, I think, one of the real deficiencies of our local government or state government, whatever it is to provide housing for people. That other states have had better solutions to this. It's a huge problem. And, they're human beings and they do need to practice social distancing, but they're still human beings and we need to address this as a community.
Well, but didn't Sam Page this week announce that the city or the county is contracting with, contracting but with hotels to provide shelter for some of the homeless people?
Yeah.
Right along
In the county, he did.
But the homeless are reluctant to go there.
I understand.
It's a tough problem.
There's also something really
I think we should leave them alone.
sick about rousting them at 4 in the morning.
Right.
I mean, you might make the argument that, well, they're going to be there, but it just doesn't sound good. I mean, it's not a good thing to do at 4 in the morning.
Right. They're human beings.
Rousting people.
Well, they were offering them some lodging. You say they're human beings, but they were offering them a place to go.
Did they have to do it at 4 in the morning?
Right. It isn't like
you mean you're not up at 4 in the morning, guys? Okay. Hey, how about Jay Ashcroft, the Secretary of State? Ray, you went after him like I haven't seen in this week's edition of the Riverfront Times.
A Rottweiler.
Pardon me?
I said like a Rottweiler.
Well, you really went after Jay Ashcroft because he's returning employees to the office.
It's just despicable what he's doing. He's got 60. Now, understand, all the health experts from Dr. Fauci all the way through every level of government are begging people right now, while we're still going upward in Missouri and places like it, upward in our numbers, to stay home. And if I know that voter suppression is very near and dear to his heart, but 60 people in the Secretary of State's office need to be forced to come into work, and not social distance. Every other office, including all the ones run by Republicans, Attorney General and the Treasurer and the Lieutenant Governor, every other office is working virtually. And Ashcroft, who is already doing things in his dad's tradition of, taking on the African-American mayor of Kansas City just by coincidence, all the other old playbook stuff, he is just trying. And he did a statement that interestingly only got reported in the Jeff City News Tribune. He says, we've got to crack the door open and we've got to sometime open up. He did all the Trump messaging, which had nothing to do with Missouri. And so, yes, I think he deserves great condemnation. I wish we could get it to where we got people are so afraid in his office to talk that the feedback I'm getting so far has not been enough to go public with. But I got to tell you, it's the wrong thing to do. It's jeopardizing the health of his workers and anyone in their families that they come in contact with.
And he's also telling people that they should go back to work in St. Louis City and Jackson County. This is not just out in rural Missouri, as we were talking before. So he's basically telling people to go back to work where the most cases are. And he knows for a fact he would not be going to work if his office was in St. Louis or if his office was in St. Louis County. I just refuse to believe that.
You know, that St. Louis and St. Louis County, that's an interesting dimension. I did not know. But he did say that he's got 90 employees, 600,000 square feet of office space, and that's about 1,800 square feet for each one. And he thinks that they can be socially distanced properly. He also said that a lot of his employees don't have the means at home to do the work. My sister's a teacher in Seattle, and some of her students cannot do the online classroom because they don't have enough computers or they don't have Wi-Fi or whatever the case is. So I don't know what you do, especially if some of the work has to be done at the office, like opening certain mail for lawsuits, et cetera.
Some of the work is stuff like the state archives that can wait. It's not like the stuff they're doing is so urgent, unless, as I say, you consider voter suppression.
Literally, someone has to open in the mail, right?
And my understanding is first of all, he's got 185 employees. He's got 60 at work, I believe. At least those are the numbers that have been reported. And again, I don't know how far to go with stuff that's anecdotal, but what I've been hearing in emails after I wrote this from people, you know, again, it's secondhand, is that what you're saying is not, what he's saying is not true, that a lot of them work in areas where they are not in cubicles, that, you know, they are exposed to danger. Now, again, I don't have it enough to, I just think, Dr. Fauci, everybody is saying, please stay home.
Don't forget,
everybody
Ray,
else is doing it, Charlie.
We all work for places where people are going into work, whether that's KMOX or KTRS.
Are there 60 employees
the
anywhere?
9
I'd like to know where
people
there's
go
60.
in. If you go to curbside dining, Ray, if you order curbside dining or delivery, which I hope everyone does for the restaurants, there are cooks in there cooking. You know what I mean?
I get it, but there's not 60 people in an office. I'm sorry.
You know, the great thing about it is we'll find out soon enough whether it was a rational decision or an irrational decision.
That's right.
If his employees get sick,
and
we'll hear about it.
These are actual lives in the balance.
Right.
We are getting the timeout signal because the first half is done. We're coming back for more with Robyn Weilbacher from Mercy Hospital. Don't touch that dial.
Donnybrook is made possible by the members of the 9 Network. Donnybrook is made possible by the members of the 9 Network.
Hey, thanks for joining us for the second half of Donnybrook on this special edition. Everybody's back, but this time with Robyn Weilbacher, who's the Chief Nursing Officer at Mercy Hospital and kind enough to join us for the next half hour. Robyn, thanks a lot.
Thank you for having me.
Well, you know, it's been really something else, the likes of which none of us have seen before, but what's it been like to be on the front lines of this coronavirus pandemic?
You know, I would tell you that I've been through H1N1. I've been through the AIDS and the HIV epidemic, through drug-resistant bacterias. And this is really something unlike anything I've ever dealt with. It's unprecedented. It's uncharted waters. It is very different. You practice and you test for these things, and still the magnitude to which this hit, we were prepared, but it's been scary. It's been unnerving at times. I will tell you though, over the last 4 weeks, through a lot of preparation and turning on a dime, we've really been able to kind of come into a new norm here in St. Louis. We're very confident that we're kind of moving that curve a little bit, which has settled people in a little bit. But to say that we were 100% prepared for something like this, a global pandemic, would not be true.
Lessons learned, Robyn, and I know it's not completely over, yet, and maybe many weeks before that. But I guess, is there like a book being written that we will now carry, not into the next pandemic, but just lessons learned? What's at the top of that list, would you say?
Oh, absolutely. I think there are some really exciting things that will carry over, and some of those are their virtual capabilities. If you walk into our COVID units here at the hospital, one thing that's very different is every single room now is equipped with cameras. So a physician can talk to a patient, and the patient can see the physician, and the physician can see the patient, and they can do an initial assessment and only have to go in and see that patient and have that exposure when they're doing their physical assessment. Nurses can talk to the patient in the room and talk to them about their medication plan and their meal plan, and not have that exposure. So there are some things like that if you see these 100 rooms or so, they're set up completely different than they were 4 weeks ago. Some of that I don't think will go away. Virtual visits, doctor's office visits, and things that 4 weeks ago we weren't doing. And now we're reconsidering, are those the right things to do? And we have a very strong relationship with Mercy Virtual here. But I think we will see that blossom and grow, and we'll see changes far into the future just from this one incident for certain.
Thank you.
I also think some of our isolation procedures and some of the things that we've kept in kind of our stockpile may look a little differently in the future. I think that was the number one concern by the coworkers here. Am I going to be protected? Do we have enough personal protection equipment for me? Luckily, we've been very fortunate here at Mercy to have that protective equipment, but I do think we'll look at that very differently as well. That was top of mind for our coworkers from day one.
Right?
If I may, Robyn, in terms of that virtual exchange between the patient and his or her team of either the physician, the nurse, could you see possibly down the road extending and being able, in a situation like this, where you could bring the families into the room with the patient on a virtual basis? I mean, I think that technology is way out ahead of us right now, isn't it?
I agree. I think, to answer your question, we're already doing that, and we've had to do that. This is the first time in my history where visitors have not been allowed into the hospital.
Yeah.
And we've made exceptions for that, compassionate exceptions, which, of course we would do. But there are times where families can't come because either they have a condition that would warrant them to stay out of the hospital. And so it is so heartwarming to see the nurses and the physicians Skyping and doing all of these things now electronically with families, whether it's to share good news that a patient's off the ventilator for the first day, or whether it's to hold their hand and pray with them because their loved one may not make it out of the hospital. Both of those things I've seen. And the nurses have shared with me, they're in a very different spot. They're used to being the provider for the patient. But in some ways, they've been that intermediate between the family, and they've not had to be in that position as much as they are today. So I definitely see that in the future as well. They've Skyped and Zoomed and done all of those things here just because the families can't be present.
Wow. Robyn, first of all, thank you for putting your lives at risk for all of us. It's just amazing, not just you and the doctors, but the techs and everybody else in the hospital world. Is there enough? There was a lot of concern about testing. Do you feel like for people in your line of work on the front lines that testing is a problem, or is it or is it getting better? What's the status of that?
Yeah, this isn't my complete area of expertise, but I can tell you that the testing is getting quicker every day. And that's been probably the biggest problem in the inpatient world for us, is that at first, to get a test back, you were talking days. And so patients were here waiting and waiting for those test results to come back, or we were using our personal protective equipment for multiple days on end, not knowing whether or not that patient truly was a COVID positive patient. What we're seeing now is those turnaround times have drastically reduced. And in fact, that's really helped us to keep patients out of the hospital, and it's helped us to keep our supplies lower. So in that way, we're seeing that turnaround time really decrease. I know for our coworkers, there are special processes that we use that if we would need to test a coworker, they would go to the front of the line. And I think even within the state, we're doing that now.
Let me ask you about surgical masks. Do you feel you have enough surgical masks for your team at this point?
I do. I think that we are well positioned here at Mercy and really across the Mercy ministry. I will tell you that the discussions now are really moving into that when our hospitals are ready to add in surgery and those things down the road, what will that look like? So they're already planning around masks and personal protection equipment. They're already looking at that because they know we'll need more probably in a month or so down the road. But I feel like we're extremely well positioned right now.
Robyn, all the talk these days among the citizenry is when we're going to reopen the city and the county and the state. If you were advising the governor, the county executive, and the mayor, what would you tell them? How are things looking?
Well, I would tell you in the county and in the city here, we're still seeing cases continue to rise. So, when I talk to my counterparts in the west part of the state, they're not seeing the level that we're seeing. I firmly believe that social distancing has helped us here. For how long we would need to do that, I don't know. But as long as those cases continue to rise here, I would be a little concerned with kind of going back to the way things were. I don't know that we'll get there in the next couple of weeks. And that would be my best guess if you asked me to go and talk to the governor today.
Now he watches the show, so you just tell him.
All right. Well, that's my advice for the governor.
Thank you, Robyn.
I think you watched the show until about 2 weeks ago. But Robyn, when you go home, do you quarantine yourself from others? Do you live in a trailer in the backyard, or stay in the basement, or?
I don't do that. I go home to my 3 children that are still at home and my husband. I do things like make sure that the clothes that I'm wearing here, I'm not wearing when I go home. We have universal masking here. So anytime I'm in the hospital and I'm on those units every single day, checking on the staff, we're universally masked here. So I feel very comfortable going home to my family. And I would say that they feel comfortable having me in their presence. Now, I have a grandson, and I have seen him very rarely since this has happened, just to be extra cautious around him. But I feel very comfortable going home to my family. I, take all the normal precautions I would take.
Is your hospital pretty filled with patients and the ICUs, or do you still have room?
We still have room. I would say a week ago or a week and a half ago, this chief nurse was getting a little nervous because we were seeing that, kind of steep climb where we were seeing, 10 and 20 more patients a day for a couple of days there. And so you start, getting those pictures of New York and California,
yes, right.
And you wonder what's going to happen. Now that we've seen that flattening of the curve and we've seen that those test results are coming back faster, like I had said earlier, we're starting to see about half the patients that we were seeing a week or so ago. And then, of course, our inpatient volume is down because we're not doing those elective surgeries and we're asking patients to stay away. So we're in a good position right now. When I talk to the other 4 Mercy hospitals across the East, they're also in a good position. And of course, we have contingent plans if we would need those.
It's hard. Go ahead, Alvin.
No, your turn, Wendy.
Your turn.
It's hard to imagine the overwhelming sense of responsibility that everyone at the hospital has for those on the front line, the nurses especially. How do you tend to their emotional needs? Because nurses deal with stress every single day. But this is, as you said, this is unprecedented. And nurses are dealing with a level of stress that the rest of us cannot even imagine while trying to protect them physically. How do you negotiate that? How do you navigate that?
You know, the one thing that I've learned about the generation of nurses that we have working at the front lines today is there's two things that are very important to them. And one is, how does the job affect my health? And that may not be something that my generation worried about as much. And the other one is, you know, I want to have a good working condition. That's important to them. And so when you're talking about a pandemic at your front door, you've really got to be very transparent with them. You've got to check on them frequently. And so when I go up on the units and talk to the staff, the questions that I ask them is, are you well today? How is your family? And do you have absolutely everything you need to feel that you're in a safe environment? And I can gauge the self-care of the coworkers based off of a few questions. And I also, I listen to them. They're flexible in their thinking. They send me emails to say, hey, I heard about this. Is this something we should be doing? I take those very seriously. They're a very engaged group of nurses. It's an emotionally taxing job day in and day out, not just at this time. So I do worry about them. And I'll tell you that both the hospital and the ministry has put in so many things for them to make sure that they're okay. We worry about them because they're away from their family. So there are things like we put in micro marts for them so they can grocery shop here. They can get their milk, their bread, their eggs. They can actually get toilet paper here. Anybody. But they
better not say that over the air.
See you later.
They can get all of the necessities that they need to go home. We've also we've done these grab and go meals for them. So for a family of 4, you can feed your entire family for $8. When you go home, you have a solid meal for them, so they don't have to worry about those things when they go home. We've set up babysitting so that they don't have to worry about that. There is a group where they can partner young adults with children so that they can take care of each other. We have crisis funds for them. There are so many healthification and making sure that they know how to talk to their children about pandemics. There is 24-hour spiritual care for them. I think we've positioned ourselves very well to make sure that just about anything they would need and any resource they would need, they could reach out to us and we could support them. So very, very proud of that work for sure.
I'm going to ask a question that I know that our viewers want. What is written behind you? Is that scheduling or is that? It looks very, very complicated.
That is my homework. I don't use a notepad. I actually write on that wall behind me.
I know you're so busy. I figured it was something like that. You got to get it down somewhere.
Yep, I do. Hey,
another question for you. Where can I get one of those nice, we love our healthcare worker yard signs? I'd like to put one out. I don't know where to get one.
You know, I'm not sure where they come from. I know that we've had the community just comes here and they just drop it off and they bring it to us, which has been so amazing. I'd be remiss if I didn't talk about the amount of food that has come in this building from just every part of the community. Gas cards, prayers. We actually have an amazing collage of letters and cards and just the cutest drawings from all walks of the community. that the coworkers have actually said that is like one of their number one favorite things is to see all the drawings that the kids have done about, I want to be a nurse, or I love you and thank you for taking care of us. So I would be remiss if I didn't stop and just thank the community for everything that they have done to make sure that the physicians and the nurses and our housekeepers and everybody that's in this building feel the love and support from them.
Robyn, where do you get the information, as you're an executive in nursing, where do you get the information you can trust? And I ask that because obviously the hospital and the system has its information. If you watch TV, you're going to get very different takes on things. Where do you get that? Where do you look for the information you can trust?
You know, we have a command center, and I will tell you that the command center is from all top leaders of leadership across the ministry. And that is a daily call where we get clear and concise information that's extremely transparent. Everything from adequate space, adequate supplies, do we have adequate staffing, and what standards of care do we need to monitor? And those 4 things are transparent, and we can see all of that data every single day. And we really start at a global level and work our way to our individual community. So I trust that data. I feel like that data, it's able to be transparent to the coworker at the bedside. I feel very comfortable sharing that when I go back out on these units. I'll also tell you that the St. Louis Metro Pandemic Task Force, if you ask me what has been exciting about the pandemic, I would tell you that the collaboration between the hospitals in this community is something like I've never seen before. And I would tell you that the information that comes out of that task force, I feel very, very confident in as well.
Dr. Garza, speaking of that task force, Robyn, he said in one of his recent briefings that he feels really positively about where we are as a community with this first wave. He said a potential second wave concerns him. Can you put into terms that we will all understand why that is so critical to keep our eye on a potential second wave?
Yeah, I believe that what they're talking about is as we allow this community to become alive again, we're going to have to be very cautious to make sure that person-to-person transmission doesn't start to rise to the level that it was here again. I think we're going to have to, nobody has that magic ball of when is it okay for us to no longer shelter in place. And so that alone could cause us to have our cases go back up. And so we'll just have to be very cautious. I think some of the communities in Missouri will be able to go up a little bit sooner than us. And so we'll watch and learn with them as well. But if I had to say, I would say that my best guess is that's what they're talking about.
Do the people in your hospital feel they have enough ventilators in case there is a big surge on April the 25th or around that time?
Yeah, that's a great question, and one that they ask me often. We actually monitor that on a daily basis as well. So we know across our entire region and really across all of the states that Mercy encompasses, every single ventilator is accounted for at this point. We also have had additional ventilators come in. So we know every single ventilator, what hospital it's in, how many ventilated patients are in each hospital. And I can tell you the percentage of capacity that we have by hospital. So, for example, one of our hospitals was seeing an influx of patients that needed a ventilator, and not just for COVID. And so we were able to shift 4 ventilators to that hospital. So our capacity is very strong right now because we didn't see that surge like we thought we were going to see and hopefully won't see. So we're in great shape.
I was just going to ask, kind of led into what I was just going to ask you. I don't plan to get on a ladder and fall off, but if I do and I break my leg, what happens to me at this point in time?
Good question.
Well, you'll come to the hospital and we'll take great care of you. But we have normal operations. So the hospital is still open for business outside of COVID. And what we've really done in many of our hospitals is part of our hospital has normal operations and part of our hospital has COVID operations. And in those departments that are under normal operations, you would come into the hospital and you would receive the exact same care that you would receive under normal conditions.
Are you seeing a drop in your emergency department in terms of, are we being a little more careful than we were being prior to coronavirus and the novel coronavirus?
Yes, absolutely. We are seeing a drop in all of our emergency rooms. Here at Mercy Hospital St. Louis, we may see 200, 300 patients a day, and it's not uncommon for us to see about 120 patients a day now. And so I think you can attribute that to several things. One is, you can call your physician and say, hey, this is what's happening to me, and I'm not sure if I need to go to the emergency room, and they'll direct you. The other thing that's happened is we've opened respiratory clinics, and that is something new outside of coronavirus. So instead of coming to the emergency room, you can go to a testing center or you can go to a respiratory clinic, and they will monitor your symptoms and tell you whether or not you're safe to go home, you need urgent care, you need a doctor's visit, or yes, indeed, you need to go to the emergency room. So in some ways, that's been a good thing for us because it's kind of kept the commotion away from the inpatient area where we're really doing the work of caring for the patients.
So, Robyn, speaking of testing, do you, if somebody feels like they should be tested, do you have the capacity right now to test people who want to be tested?
I think we have the capacity, and again, a little bit out of my swim lane, but we have the capacity to test patients who are symptomatic in some way. And I don't know that we have the capacity to test anyone that wants to be tested, that universal testing concept. I don't know if or when we'll get there. I know people are talking about that.
Okay.
Do you still have that tent where people drive up and get tested?
We do. And here in the emergency room, we actually have something that's new to me, actually, is called forward triage. And normally under circumstances, regulatory requirements would not allow you to have it. But what it is you can actually drive up to the emergency room and they can assess you before you ever enter the emergency room. Very new concept, but they'll tell you, you know what, you just need to be tested. And we test about 15 patients a day that way. And we're going to test you, and then you can go home and wait for your results. Or no, I think you do need to go into the emergency room. Let's take care of you there. Those have been set up all across the country. And it actually, again, was to prevent a surge of or influx of patients into the emergency room.
Most interesting.
Are we at a point where we're doing so well that medical, I mean, not so well, but that the situation is enough under capacity that your colleagues in the medical field might be answering the call to go to places like New York and others that have been, calling out for more medical people?
I think the immediate stance, and I'll talk about nursing in general, because we have had nurses just recently within the last week say, I would love to go there and help. And what we've said is we're not sure that we, like I said, here in our location, we're still seeing the number of cases rise. So there's a concern that we will need their support here and then they won't be here. And we also have to remember that the healthcare professionals are more likely to get COVID. And so we have to make sure that we really protect that valuable healthcare worker here in our own environment before we have them move to another situation where we can't get them back, so to speak. There's still travel restrictions. There's multiple avenues there. And we would never want a healthcare worker to sit and not be able to help somewhere. I think here we're still a little nervous that it may not just be the right time to start having people kind of go throughout the country helping. So, and we may get there.
Well, we have just about 1 minute to go. If you were to share some wisdom for our viewers out there, just some words to the wise in this age of COVID-19. What would they be, Robyn?
Well, I'm gonna talk specifically of the healthcare workers, and I'm gonna try to do this without getting too emotional. But I've never been more proud to be a nurse and to be a healthcare worker. They are truly the heroes of this pandemic. They are true heroes. And I don't know that I've ever used that word through anything in my career that I've gone through. But when you walk in those units and you see the physicians and the nurses and the housekeepers and dietitians, pharmacists, all working together, all masked up, all gowned up, and they are walking into the fire to care for their community. I just have never been more proud. They are.
Thank you. Thank you
heroes.
so much.
Thank you.
Thank you for all you do,
Robyn.
and thank you for joining us. Robyn
you for
Weilbacher,
having
Chief Nursing Officer at Mercy Hospital. Thanks, everybody. Thank you, Robyn. We'll see you next
Thank
week
you.
at this time.
Donnybrook is made possible by the members of the 9 Network.